In this case, we are presenting a video for a large hysteroscopic septal resection. The patient presented with the typical complaints of primary infertility, which on 3D laparoscopy was diagnosed to have a large hysteroscopic septum. As you can identify on hysteroscopy, the septal margins are identified along both the medial margins of the uteri, and here you can categorically see the uterine septum, which is extending almost till the level of the internal os and just beyond the cervix. As we enter the other cavity in order to identify the ostia of the opposite end of the uterus, typically hysteroscopic septal resection for such a large septum is done using hysteroscopic bipolar current. Using the hysteroscopic bipolar, the resectoscope works extremely fast. The trick of the procedure is in order to keep on dissecting using bipolar current till either both the ostia are categorically visible from the plane of the internal os, or till we have identified the uterine musculature, which can be identified as separate fibers as against the fibers of the septum. Usually the septal fibers are fibrotic, whereas the fibers of the uterine musculature have a varied contexture. The surgery finishes once the septal resection is complete.